Today is December 1st and is World AIDS Day. UN Secretary General Ban Ki-moon is praising the progress in the world has made in combating AIDS, but warns the gains remain fragile. Sub-Saharan Africa still accounts for more than 70% of the HIV-infected population, but new infections have declined by 1/3 since 2005. While experts predict that if prevention and treatment services are scaled up, the HIV and AIDS epidemic will no longer be a global threat in 15 years. Well, VOA's Pearson reports.
For 30 years, Dr. Anthony Fauci has been the director of the National Institute of Allergy and Infectious Diseases. In 1984, there were no drugs that targeted HIV/AIDS. Now there are more than 30. Dr. Fauci describes the progress in controlling HIV/AIDS as extraordinary.
You can put someone on antiretrovirals relatively early in the course of their infection, and they stay on their drug. If it's, let's say, a 25-year-old HIV-infected man or woman, you could look them in the eye, as I do when I see them in my clinic 3 times a week, and tell them if they stay on their drug, you could project that they will live an additional 50 years, which is really one of the most extraordinary accomplishments in biomedical research and translation.
But the latest study shows only 30% of Americans with HIV are getting the right treatment for their disease. The number drops by half for those between the ages of 18 and 24. Some experts blame the human factor.
So I turn it and do the bottom? Do the bottom.
Some people are afraid to find out their test results. Others are tired of taking pills, don't feel like using condoms, and worry about the stigma that comes from having HIV.
In Kenya today, there are women who are HIV positive, but they will not reveal their status.
Howard University in Washington sponsors a yearly conference to examine the stigma associated with this disease. Rod McCoy works with an organization that provides HIV education and testing. He's also HIV positive.
One of the things I'm concerned about as a health educator is not so much people, well, yes, people staying on their meds, but also people who are not infected having the mentality of, oh, people take medication, so if I get infected, I'll be fine. My concern is around the complacency around prevention because of the success of treatment.
Dr. Fauci tells people at forums like those at the Center for Strategic and International Studies in Washington that complacency is why a vaccine against HIV is so needed.
When we start seeing that there's such a low level of infection and the numbers look good, that we're going to have a rebound. So my conclusion then is that it really is essential to durably control and end the AIDS epidemic is to have a vaccine.
Even with extraordinary accomplishments in AIDS treatment that are driving down the numbers of people who get HIV, more than 35 million people around the world still have the virus. And the United Nations reports another 1.5 million people died from it in 2012. Far too many lives to become complacent. Carol Pearson, VOA News.
Well, for more insight, we're joined via Skype from Massachusetts by Pauline Muchina, founder of Future African Leaders Project, which is designed to support promising African youth who face serious challenges, including HIV/AIDS. Ms. Muchina, welcome to Africa 54.
Thank you.
Now, we're talking about an AIDS-free generation, but we know that in the 80s, there were thousands of children who were born HIV positive, and they have been living with the virus since then. Is this an often forgotten challenge?
Definitely. This group of children seems to have fallen through the gaps and, or rather cracks. And most of them, remember, don't have their parents living because their parents died of HIV and AIDS. And also their caretakers, maybe family members who took them on, also have died of AIDS. So they're left to cater for themselves. Some of them became heads of the household at the age of 10, 14, like some of the ones that we have in our program. And now they are maturing. They are becoming young adults.
And that's a new challenge. Now they're becoming young adults who are looking forward to things like dating, marriage. What
Exactly.
challenge does that present to them?
A big one, because, for example, in most sub-Saharan African countries, they don't talk about sex. They don't teach young people how to protect themselves from HIV infection, or if they do, they will use different words that don't really make any meaning to these young people. So these young people are having to teach themselves about these things, and they're having to either go to the internet or read about it rather than getting it from the adults in their community. Also, the girls are very, very, very vulnerable because they are maturing. You know, men in the community are going after them. Even some of them don't care whether they are HIV positive or not. And most of them are getting pregnant. Most of them are, you know, getting married at that age. And nobody seems to really provide the kind of support they need, especially protecting them from men who prey on them, and also giving them psycho or rather counseling, so
Yeah.
that they are aware of how to live positively with HIV.
But address a little bit the stigma factor of this generation that had nothing to do with HIV virus. I mean, they got it not out of their fault.
That's true. And most of them don't know they are HIV positive until they get very sick. And then they get to the hospital and they find out that they are HIV positive. And the people in the community, once they find out they are HIV positive, don't want anything to do with them. Especially, even sometimes their own relatives will want nothing to do with them. So these kids are left to their own. And when you look at the stigma that affects them, it's not only stigma because they're HIV positive, it's also stigma that is related to relationships, you know, things like gender-based violence, things like stigmatizing people because of they are now sexually active. It's a natural phenomenon, which you can, just like eating food. So why not provide them with the kind of care they need and the kind of knowledge they need to
We
live
will
positive.
continue with this conversation. Pauline, Ms. Muchina, thank you very much
Thank
for
you
talking
so
to us today.
much.
Okay. Now, Pauline Muchina is the founder of Future African Leaders Projects, designed to support promising African youth who face serious challenges, including HIV and AIDS. Now, we want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook and check out our headlines 24/7 on voaafrica.com.